My name is Phoebe Montgomery, and I'm a certified nurse midwife here at Denver Health and a women's health nurse practitioner as well. So I started the doula program here at Denver Health a few years ago because I really saw a need in the patients that I work with on a daily basis. Here at Denver Health, we serve patients who both have insurance and don't, and we serve a lot of underrepresented populations. And not everyone has that awesome family partner support that one thinks of when they think of childbirth and bringing new life into the world.
It's not just about the emotional piece that's happening, but it's about really making this feel like a home-like environment during one of the most important times of their life, and it eases that sterility that you can sometimes feel in a hospital setting.
A doula is someone who has gone through a training to be of service and be of support for someone who's giving birth. So they, help someone emotionally, because a lot of emotions come up around birth. Certainly, it's a very powerful, impactful time in someone's life. They help people physically through support, position changes, massage, touch, even as simple as holding a hand, something like that. And then also suggestions about things to do, movements that can be helpful, comfort measures, things like that. Sometimes, people don't fully understand a lot of the medical jargon that can come up during childbirth, so they can help kind of clarify some things or help medical translation, as it were, between the staff and kind of bridge that gap between the staff and the families that are giving birth.
A lot of times, a lot of families who come don't know what's happening in their labor. And so from an educational standpoint, giving that knowledge right when it's happening to the family can ease a lot of the fear that is there when we have childbirth. We are a nation that doesn't talk a lot about birth, and we don't talk a lot about death. And so there's a lot of fear surrounding that. And if you can ease the fear by educating whoever's in the room, the mother who is laboring, the father who maybe they're the support people as maybe a grandparent, or even older children, siblings that are inviting their new sibling into the family. There's a lot of the unknown, and a doula can bring in the physiological definition of what they are about to encounter.
I think that if a family has never heard of a doula and isn't familiar with that as an official title, sometimes there can be a little bit of confusion and uncertainty as far as including someone who they have never met before into such a personal experience. But at the same time, I think that once you explain that it's a really wonderful birth support person, what their role is, what those parameters that they're going to work in are, the families are a lot more reassured. And I can say, single-handedly, across the board, every single family that has a doula raves about it after the fact. They're super happy that they have it. They talk about how they want to do it with every baby and how they highly recommend it to everyone. So all in all, even if at first it's not necessarily something that's as well known, once that is implemented, the families are very happy with it.
The volunteer doulas have been absolutely incredible for our patients. We have a busy unit, so the docs, the midwives often have full loads of multiple patients, and so they can't give one-on-one time. And then when the unit is full, the nurses often will have 2 or 3 patients that they're managing at a time. So the nurse and the doc and the midwife, none of us can be in the room 100% of the time. We take care of a lot of prisoners at Denver Health, and one of the criteria when a prisoner is in labor is their only person that can be with them is the guard. And so really the staff becomes their support members during the course of their labor. And you can imagine how scary that would be. And so one night in particular, I remember our doula manager was here, and she was training a new volunteer doula, and they went in with a prisoner and spent the entire 12-hour shift just with her, gave her aromatherapy massage, just helped her relax, helped her take a break between her contractions, and offered her that emotional support that she needed during that entire experience. And it made a huge difference for that patient. And she had a normal delivery, and I feel like that was a huge part of her being able to successfully relax and allow herself to experience labor.
The clientele that we have the opportunity to work with are so appreciative. Often they say, "You work for free. Why do you work for free?" And by the end of the time that we have together, they understand that my love of birth is why I choose to come and volunteer. And so when you're having volunteers do this, it's more than a monetary gift could give. And the impact is real when you see that smile, or you see that family come to you and with tears of joy in their eyes as they're welcoming a family, and you know that you've given them something that they otherwise could not financially afford.
When you're in early labor, it's a big shock of how much pain that can be, and sometimes it's the easiest time to quit, where you're like, I just want medication. I can't do this. You really get a lot of self-doubt happens. And even if you have your strongest partner next to you, having another supportive partner there to let you know that you got it is mind-changing.
I'm Kate REINEMUND. I'm Executive Director of Constellation Philanthropy, and Constellation is a collaboration of families that are committed to investing in early childhood across Colorado. We have been delighted by what we've seen so far in the program. We're seeing folks come into the doula program that are introduced to the whole medical field. So we've seen people that benefited from the doula program, opted to volunteer to come into the program, and then have been able to continue on into the medical field more broadly. And so we think of it as a great workforce development tool for these women, especially to understand what it's like to be in the medical field. And we see the great impact stories that have been coming out in terms of the families that have been able to benefit as well. So we've just been delighted to be able to support it, and look forward to continuing to support it over time.
So thank you so much to every single volunteer doula that has come through our program. You are all amazing and wonderful, and I thank you from the bottom of my heart.
Thank you so much to each and every one of you who volunteer your time and your effort here at Denver Health as a doula. We could not do this program without you.
This time that you give is a gift. Your expertise and your encouragement is a talent that aligns perfectly with our Denver Health values. Those values of excellence, compassion, relentlessness, stewardship, and learning. Thank you for all that you do. Thank you for all that you bring. And thank you for being a part of our Denver Health family.